pulmonary rehabilitation for COVID-19. We talked about the major symptoms of COVID, which are sore throat, fever, chills, fatigue, cough, brain fog, shortness of breath, and these cough and cold type symptoms. So these are how you know that you have COVID. Then you get tested and hopefully you've been vaccinated, but it's after getting COVID. Now we're kind of over that hump of everybody having gotten COVID. I guarantee you most of your family and friends have gotten COVID. And as much as it sucks, and they've been treated with the treatments, they've been vaccinated and they've done everything that they can do, they still have these progressive symptoms after. So that's long COVID. And it's about 25% of patients who have gotten COVID end up developing long COVID. And one of the biggest problems in long COVID is that you continue to have the shortness of breath. I used to be a big runner. I ran New York City's marathon last year and trying to run this one this year, but I couldn't go up a hill. And I remember going up a hill near my house and I was just so out of breath. And had I known these exercises and done them before, it might have really helped because I didn't know this stuff. And this stuff wasn't even around. Nobody knew what it was. The whole world was shut down. It was a crazy time. But now we have the resources and the tools. So what can we do to combat these long-lasting symptoms of viral illness that kind of came from nowhere and rocked our whole world? So last time we talked a little bit about chest PT. We talked a little bit about the placement of hands and where you can massage, kind of break up and stimulate the lung tissue and to kind of start like dislodging secretions out your lungs and improve oxygenation. If you're doing chest PT, the big purpose of that is for people who are really mucousy. If you find yourself after having had COVID still having a lot of mucus, it's like green stuff you spit in the sink, this might be a really useful way to kind of get some of that stuff up. Other things that you can do also are steam showers, because the steam really brings that mucus up. The chest PT will help dislodge secretions that are lower down, but the higher up ones, sometimes the steam is really effective in bringing those secretions up and helping you dislodge that and expelling those, because the secretions contain bacterial particles, viral particles, all the gunk that we don't want in us. We also talked about controlled breathing. So controlled breathing can be done in a multitude of ways. A lot of times what happens is after a pulmonary illness, your breaths become a lot shallower. So when your body isn't able to oxygenate as well, your breaths are shallow and quick. And that's what we call something called tachypnea. It's when doctors measure your respiratory rate, but basically it just means that you're breathing really fast and you're not breathing properly. It's like you keep moving your arms to try to run, but you're not getting anywhere. Same thing with this. You're trying to breathe so much, but you're not able to fully expand your lungs and then collapse them. So that's where controlled breathing really makes a difference. It's allow your breath to relax, because what happens a lot of times after a viral illness or any kind of illness is a lot of these effects that are long lasting are because of the resultant inflammation from the viral particles. It's basically your tissues are still in this state of they've been injured, and so they're still kind of exploded. They're flipping out a little bit. You got to calm them down and say, hey, lung, it's okay. The virus is gone. I'm better now. Let's go back to normal. And the same way you do in your head and you're like, oh my God, so many thoughts and you're going crazy. And you kind of have to take a step back and be like, okay, no, I'm okay. It's okay. Like I can do this. Is the same thing you have to tell your lungs. And the way to do that is to control your breathing. So sometimes you close your eyes, take a deep breath in for 3, and then exhale for 3 through our mouth. Deep breath in through your nose, fully expand your lungs for 3, and then exhale slowly. What you guys don't realize is that kind of stimulates the vagus system and the rest and relax parasympathetic system in our body. So we're not in this inflammatory state. We're not in this adrenaline state where our body's like, oh my gosh, I can't breathe. And so this tells your body, 1, it helps with blood pressure because deep breathing has so many other positive effects, but 2, it reminds our lungs that they can fully expand and fully collapse. And so the way to do this, that's the 1, 2, 3 method, or the 4, 7, 8 breathing technique. You inhale and then you exhale for a little bit longer, then you inhale and then you exhale for a little bit longer. So if you're inhaling for 5 counts or 4 counts, you're exhaling for 7 counts. If your nostrils are blocked, you can put your finger on one and breathe in and out through the other one, and then switch fingers and then breathe in and out through the other one, just to encourage passage through your nose. Also diaphragmatic breathing, it's the same thing with the deep breathing exercises, and you're trying to activate your diaphragm. And you can even do it to music to make it a little bit more fun, like put on a slow relaxing song that's like 8 count and go from there. Also to increase mobility, because again, with the chest PT, you're trying to move like your lungs. So when you're sick, oftentimes you're cuddled in a ball, you're hugging yourself, your muscles kind of tense up, your lungs kind of tense up. So when you've recovered, it's about letting everything relax. And so if you inhale and put your hands behind your back, that's forcing your lungs to interact a little bit differently. When we listen to your lungs, as physicians, we listen in the front, and then we also listen in the back, because your lungs are also in the back. So your paraspinal muscles and your rib cage, they're all compressing your lungs too. So if I'm moving my arms like that, I'm kind of expanding my posterior rib cage and stretching out those paraspinal muscles, and that's kind of giving a little bit more space for my posterior lung fields to expand and collapse. And same thing on the other side. Every organ is not separate. Every organ works together. So if you're stimulating muscles and bones, or you're moving them in a different way, it affects it. And Another thing big for athletes, like if you see any runners after a big race, they'll put their hands behind their head because they're just trying to increase blood flow to the heart. And by doing that, you're also allowing your body to just relax. Everybody has a different sensation and a different feeling that really helps them control their breath. We're going to talk about incentive spirometry next. Spirometer. It is really cheap. And if you've ever been admitted to the hospital, they give it to you, but also you can buy it in the pharmacy for under $10. Nobody ever uses it. It's like one of those things that really has so much effect, but you have to know how to use it. It's this little plasticky type device. It's got two pieces. So it's got this little tube and then it's got the incentive spirometer piece. So it's got the tube, it's got the incentive spirometer, and there's a hole to put the tube into the little machine. You pull out the tube and then you angle up the nozzle to go into your mouth. Again, this is for one person. So if you're using this, I would make sure you have a different tube before somebody else uses it, just because we don't want to get anybody else sick. Even within the same family, I would change out the tube. But you take a deep breath in and you hold it for as long as you can. You try to inhale as much as you can. And this is basically to just open up those lung fields. So any patient who's gone through surgery or is in the hospital for a prolonged period of time, this is a rule that they have to have this at bedside or at least have the order in. So whenever I admit a patient to the hospital, this is one of the things I have to mandatorily order for every single person, because when you're sitting in bed all day, something called atelectasis, that's a fancy medical term just to say that your lung sacs kind of collapse. So your lung sacs get a little bit lazy. And it's not that they're dead, it's not that they're not working, it's just that they've been kind of lying there for a while. So they fatigue like any muscle, they shrink, they get tiny. And so in order to work that muscle again, you really want to encourage deep breathing. So this helps because it's showing you how deeply you're breathing. So when you're breathing, this little blue thingy will go up and you want to try to get it up as high as you can. And you want to ideally do it 10 times per hour. So that's the goal, to inhale, to move the dial up, to do it about 10 times per hour, to increase your lung fields, to kind of aerate your lungs and to improve aeration. It's a really effective tool in helping post-long COVID. It's like a little game to encourage you to just breathe deeply. And even if you don't have the incentive spirometer, this is an important thing. Try to take deep breaths. Try to stop with that shallow hyperventilation, because that's what we do when we get nervous too. This is another really cool video. It's just showing some exercises. Like we talked about that whole lung body, like how your organs are all connected. And so physical movements can really help your organs. There are certain moves that you can do to rehab your lungs to help increase movement of air in and out through your lungs. Stay hydrated. That also helps post-long COVID. There were some studies that showed that. I know everybody has different levels of mobility. The cat and cow yoga pose that's shown here, which is like going forward and then going back and then going forward and then going back. While that's great if you can go on your knees, not all of us can. And so if you want, you can even put your hands against your desk and push your shoulders forward and push back and push your shoulders forward and push back and breathe in and out as you do it. And sometimes that provides a lot of relief. So in for 2 and then out for 2. And same thing as you're going back and forth. But another one is the standing march. So for people who can stand and have a chair, if you're just reminding yourself how to walk and how to improve, this is not necessarily affecting your lung fields how it is like if we're moving our chest, but this is to show an improved ambulation, because a lot of times after COVID, your walking tolerance, your exercise tolerance might be decreased. And that's a result of not being able to provide enough oxygen to your body. And part of that is cardiovascular, part of that is related to your pulmonary and your lungs. But to help practice and to help retrain your body, this is just a standing march. You're holding a chair and you're marching up and down, and it's simulating walking. And in that, you're putting less pressure on your joints and you're not going uphill or downhill, but it's just, I'm learning how to breathe again as I'm ambulating. And so it's a controlled setting. And that's one of the first things that people do when they've had COVID and are learning how to exist again in the real world. In this video, they're showing an exercise method, and they're showing how if you have a partner, you have somebody who's in the house with you, how they can do exercises to help them with the airway drainage. So this is chest PT, where they're kind of cupping in there. It's like almost a massage for your lungs, because it's not helping your back, but it's kind of breaking up the secretions. The lungs have these like little sacs, they're called alveolar sacs, and the little sacs, by doing the cupping and stimulating, that's really what chest PT does. And this is like an exercise that people use to improve airway drainage. We talk about long COVID and the symptoms of long COVID, and one of the biggest things, I'll touch on it really briefly, is brain fog. Brain fog is a huge thing post-COVID, and the reason that I pick brain fog is because like so many of us don't even realize realize it, but there's a couple of patients that had COVID and they've come into rehab and they were physicians, they were lawyers, they went to college, but they can't remember things the way that they used to. But brain fog is categorized by a difficulty concentrating, confusion, unexplained fatigue, forgetfulness, losing your train of thought, trouble paying attention, and slow thought process, not having the right word. It's something you can't figure out. It's like on the tip of your tongue, but you can't remember, and you might not even notice, but it might be the people around you. If you notice you or your loved one isn't feeling as sharp as they used to, definitely try sleeping. Definitely make sure you've eaten. Those things always cause me a little temporary brain fog, but especially if you've had COVID or another serious illness, you can develop this kind of brain fog. And again, the best treatment for it is to vaccinate, but there are a couple of other things that we can do to also help combat it, like decreasing stress, improving mental health. But for long COVID, there's a study that Sinai is doing. There's a lot of institutions that are doing studies on long COVID, but the cool thing about them is that if you choose to participate in this study, they often give you some resources to help combat some of these symptoms if you are experiencing them, and they can help diagnose it. This is to say that your symptoms are valid. Definitely get it checked out. And again, the best way to prevent long COVID symptoms is to not get COVID, and that's by vaccinating.